extraordinary woman who's going to come in to speak to us. She has been in Uganda for the past 6 months, and she's coming in to talk about this healthcare issue that I mentioned. So now, Ms. Bennett. So nice to have you with us.
Hi, thank you guys for
You're
having
Miss
me.
Bennett, Miss what?
Stephanie.
Oh, nice to meet you.
Nice to meet you as well. Thank you guys for having me today. I wanted to discuss Clostridium difficile, or C Diff as it's better known. As she just said, I have just come back from Uganda, and I encountered this illness there. And it's not only in third world countries. It's actually very prominent in our healthcare system as well.
Ours?
Yes, in our hospitals and our other healthcare facilities.
Now wait, patients in our hospitals are getting more infections? Like they're not going in there with this infection and they're picking it up? How does that make sense?
A lot of times, if a patient is on long-term care antibiotics, say they have a really big infection and they're on antibiotics for a very long time, they can develop this as a secondary infection. Also, they can get it from people passing it to each other. It's very, very contagious.
Yeah, people don't always wash their hands. I don't. Even the healthcare workers, you see them go in there and they don't wash their hands.
Oh, I know. Don't even get me talking about the hand washing. I have a story about that. I was visiting my grandmother the other day. Bless her soul. She was laying there in her bed because she had developed a foot sore between her toes. Really gross. Anyways, she came in. She didn't do that foam in, foam out stuff. I don't know. I keep hearing somebody say foam in, foam out.
Yeah, the sanitizer.
Yeah, this looks nasty anyways. It smells bad. But anyway, she didn't do that, and she didn't come in and wash her hands. She did it with gloves on her hands, which I thought was really gross. And then she took it upon herself to take off my grandmommy's sock and touch her toes, and she put her finger with her nail, she had a fake nail, in that sore. And you know what she did? She stuck her hands through her hair.
Oh, that's nasty.
That's just gross. It's just sick.
It's reasons just like that, but it's very important that we discuss hand washing. Does everybody know the 15-second rule?
Yeah, happy birthday.
For those of you who don't know the 15-second rule, you sing happy birthday, twinkle, twinkle, little star, something to that effect to yourself twice.
Some of us don't have
So you don't have to sing out loud if you don't feel comfortable. You can if
Please
you
don't
want.
sing out loud. Praise Him.
Okay.
But what you do is you're washing your hands, say you went to the restroom or you're about to eat dinner, and you wash your hands using warm water preferably. If not, then cold water's fine, but preferably warm water. And you use a good amount of soap. Don't just do one squirt. I'd say 2 or 3. And you scrub between your fingers. You scrub underneath your fingernails, underneath your watch, in your rings. You want to scrub your hands. You'd be surprised how much bacteria and dirt gets stuck in your rings.
Thank you, Ms. Bennett. That's an excellent reminder to all of us. And this is a chance for me to fuss at those of you who don't wash your hands. Shame on you. Continue, Ms. Bennett.
Oh, okay. So, Clostridium difficile, one of the biggest things that this illness causes is watery stools, or better known as diarrhea.
Doesn't sound easy.
Oh my gosh, a crapping disease that'll kill you.
Exactly. You're right. It could possibly kill you. What it is it's rare. It's rare, let me say that. What it does is these watery stools dehydrate you. It's not just one bout of diarrhea in the bathroom. It's for longer than 2 days, 3 or 4 times a day, 5, 10,
Oh my.
lots and lots of excessive diarrhea. And what this can cause is sepsis, colitis, and even possibly death, just like Tish said.
It's just terrible.
From
Talk
diarrhea.
about the dying diarrhea.
Very
How
good.
is this transmitted?
The Clostridium difficile is transmitted through hand-to-hand contact. If someone, let's say someone with C Diff goes and uses the restroom and doesn't wash their hands afterwards, and then you go and shake their hands, or you use the doorknob after.
So it's like the pooping around, the fecal.
Exactly, exactly,
Okay.
fecal to oral. And what you do is say you touch that handle, and then you go and you eat your sandwich for the day. Then you've just ingested that bacteria, and so you've got it. So it's very important that you wash your hands.
I
That's
thought you
what
made the coffee wash their hands.
You know how many people you see when you use public restrooms and they come out and they just leave? Oh my gosh.
All the time.
Yeah,
That's
this
so
is,
disgusting.
it's ridiculous. You're not in that much of a rush where you can't be
Spend
clean.
15 seconds to wash your hands.
Happy birthday.
So back to hand-to-hand contact. If a person, oh no problem. If a person's in the hospital setting and they have C Diff, then they're going to be put on what's called contact precautions. And when you're put on contact precautions, that means that the healthcare workers will then have to wear gowns and gloves or other protective equipment when they actually touch the patient. And that way it doesn't get on their clothes or on their hands.
Oh, okay.
What about the visitors and the family members that come in? Do they need to put all that stuff on too?
Yes, they should put on the gowns and the gloves and gear up just like the healthcare worker does. If the healthcare worker, they can't force the family members to do it. If they want to go and hug grandma, then they're going to hug grandma. We can't do anything about it, but we really, really highly suggest that they put on these contact precautions.
Well, I don't know how many families and visitors are actually gonna follow that, because, you know, they think, that's family, that's my sick family members, I can
Oh,
just
my.
hug them.
They
It's
don't
no
follow
big
it
deal.
closely. I mean, I've had some relatives in there, and I see these little signs and these little devices on their doors that say don't come in, or if you do come in, put stuff on. But you know what pisses me off? We go there, and they'll tell me, well, you need to put your gown on. Well, I see nurses walking in there. I see doctors walking in there. I see the radiologists and everybody else. They don't put their gloves on. They don't put that gown on. And sometimes I know that if you have the flu, you have to wear a certain mask. And I've never seen people.
Okay, we don't want to hear your whole story. Why don't we just?
Oh,
Well, you brought up a
Continue,
good
that's
point. You
bullshit.
brought up a
see,
good point. If a person has the flu, that's different than contact precautions.
Okay.
Then they're going to be put on droplet precautions. Okay, there's 3 different types of precautions that the CDC discusses, and you can go on the CDC website and learn more about them.
Okay.
But I've already discussed contact precautions, which are things like C Diff and MRSA. And then you can go into droplet precautions, which are like the flu and things that we can pass through, like whooping cough and stuff like that. Things that are passed through saliva and droplets. When you're put on, yes, droplets.
So you mean it's gonna rain diseases?
No, she means that when you go visit someone in the hospital, get in your hamster ball and just roll around, because there's so many precautions for everything.
Exactly.
But
But
just
droplets.
something about rain.
It's droplets, isn't that
Oh my
right?
God, you were such an idiot. Lack of education, blonde. Oh my God.
You know,
Seriously,
No, when
we
you
are
cough,
talking
when
about
you cough,
diseases and rain
droplets.
with you, and you're wanting to know just how many times it's rained. How many times has it rained past time? I don't know, like 15 times, and you think that every time it's rained, someone got sick. The
well,
flu. That's what
I
it's
didn't
getting.
know.
It's
When
rain.
you mean droplets, I think of rain.
Back to droplet precautions, if you don't mind me interrupting. Droplet precautions, you can see those masks. Some of you might have been to the hospital and seen these masks that the healthcare workers wear, and they're hanging outside the door. If you're on droplet precautions, you wouldn't, but the patient is on droplet precautions, then the healthcare workers would then wear the masks or
Now,
the goggles.
what kind of mask? Now, I've seen the little flat, flappy ones that you just wear over and tuck behind your ear, and then I've seen the big, they look like construction workers.
Yes, those masks are actually called N95 masks, and those are actually for the 3rd type of precaution, which would be called airborne precautions. Airborne
Okay.
precautions are different than droplet precautions. Airborne precautions are for things like TB and chickenpox, shingles, things that are passed through the air. Those big old masks that you were talking about, those N95 masks, do not allow anything into your mouth or your nose as you're breathing.
So it's like really, really fitted.
Exactly, exactly.
Like
And-
army type, right?
It's like
wow.
warfare type things. Anyways, if a patient is on airborne precautions, then they're going to be in a room that's called a negative airflow room. And what it is it keeps the air from going out underneath the door or through the door as you walk out. It keeps the air in that room.
Okay.
You can also put a HEPA filter in there, which takes the air out and puts it outside so that you don't transmit it.
Okay, now, last time I went to the hospital, I saw this sign that said something about, we want to try to decrease noisy infections. What's that?
Nosocomial infections.
Oh,
That's what
okay.
we're talking about when we talk about hospital-acquired infections.
That's where the doctors and the nurses don't wash their hands and they give their other
Right, so if
diseases.
you see a healthcare worker that does not foam in, foam out, politely say, could you foam in for me? It would make me feel more comfortable.
Before you
Okay.
touch my mother-in-law.
And then if you
Exactly.
see anything, any kind of equipment, mask or goggles or gown or gloves, then you just put that stuff on.
Yes.
It's outside.
Better
the room.
safe than sorry.
Okay.
Sounds good.
Well, ladies, Miss Bennett, thank you so much for teaching us about
Thank
C.
you.
Diff and about
And everybody, let's give this speaker a